Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then precipitating factors of atherosclerosis. So in the precipitating factors of atherosclerosis, we have four main important. First, we have fibrinogen. Okay, fibrinogen levels. What does these fibrinogen levels indicate? So these fibrinogen levels will they will correlate with the coronary risk. They will correlate with the coronary risk, and they will also provide information regarding the coronary risk independent lipid profile. Independent of lipid profile, they will also give us the coronary risk assessment. So these fibrinogen levels will correlate with the coronary risk, and they also provide information about the coronary risk independent of lipid profile. And they also tell us about the or give information, or they will predict the coronary risk independent of lipid profile, that is fibrinogen levels. The second one is we have waist to hip ratio. So waist to hip ratio, this waist to hip ratio will tell us about the adipose tissue distribution in the patient. So it will tell us about the adipose tissue distribution in the patient. So if you see, this adipose tissue distribution can be of male pattern or female pattern. In the male pattern of distribution, there is excess of fat is present in the abdomen compared to the thighs, compared to hips, whereas in female pattern excess of fat will be in hips compared to abdomen. So if they say that there is increased waist to hip ratio, if there is increased waist to hip ratio, then this is actually associated with symptomatic cardiovascular disease, and also it is associated with cerebrovascular disease also. Symptomatic cardiovascular and cerebrovascular disease in both men and women are associated with this waist to hip ratio. Then we have the next important risk factor is hyperhomocystinemia. In hyperhomocystinemia, you will see that there is a strong positive correlation will be found between the atherosclerosis. So it is actually positively related to the atherosclerosis, that is, there is correlation will be present between the atherosclerosis and homocysteine. So this homocysteine level, the major factor leading to homocysteine level is actually folate deficiency can result in homocysteine level. So the treatment of this is mainly giving the vitamins like folic acid supplementation is given with vitamin B6, and pyridoxine is given to the patient. Then we have hyperlipidemia. Hyperlipidemia is also one of the predictory factor. This is primary hyperlipidemia. Now, the primary hyperlipidemia are of many types. Okay, so in the primary hyperlipidemia, first we have type 1 primary hyperlipidemia. This is also called as familial hyperchylomicronemia. Okay, so this type 1 hyperlipidemia or familial hyperchylomicronemia has no increased risk of coronary artery disease. Then this will also show presence of xanthoma is seen, that is in type 1 you will see presence of eruptive xanthoma are seen in the patient with pancreatitis is also associated with this. Okay, then we have second type is we have type 2A, or we can call it as familial hypercholesterolemia. Okay, in type 2A or familial hypercholesterolemia, here you will see that there is accelerated or there is increased risk of coronary artery disease is seen in the case of type 2A familial hypercholesterolemia. Here you will see presence of tendon xanthomas. Whereas next we have type 2B, or we can also call it as familial combined hyperlipidemia. In type 2b or familial combined hyperlipidemia, even here you will see presence of increased risk of coronary artery disease and nothing else. Then we have type 3 or familial beta lipoproteinemia is seen. In familial beta lipoproteinemia or type 2, here there is increased risk of coronary artery disease is seen with palmar xanthoma. Then we have type 4. This is type 3. Then we have type 4. Okay, in the type 4 are also called as familial hypertriglyceridemia. In type 4 or familial hypertriglyceridemia, even here in type 4 or familial hypertriglyceridemia, we will see that there is increased risk of coronary artery disease is seen. Then finally we have type 5, which is called as familial mixed hypertriglyceridemia. In familial mixed hypertriglyceridemia, here you will see that there is eruptive xanthomas are seen in the patient and there is pancreatitis, but there is no risk of coronary artery disease.
Thank you and thank you for watching.